Now let's take a deep dive into this big LGBTQ story for today. I'm Cal Gadraj, and let's queer up South Florida and Florida. Kane Community Health announces long-acting same-day injectable PrEP. In a groundbreaking move to curb the spread of HIV, Kane Community Health has launched a same-day injectable PrEP program, marking a major leap forward in HIV prevention efforts across the country. That means eligible individuals can walk into a Kane clinic and leave protected, with their first injection administered immediately. Marlon Pittman, Executive Vice President and Chief Operating Officer at Kane Community Health, said, quote, "This innovative program significantly reduces the barriers to HIV prevention by streamlining the process from consultation to administration," end quote. The injectable form of PrEP, which stands for pre-exposure prophylaxis, is especially helpful for those who struggle with the daily pill regimen. It's discreet, long-lasting, and designed to support consistent protection for people most at risk. This life-saving service is now available nationwide at Kane Community Health clinics across Arizona, Florida, Nevada, South Carolina, Texas, and Virginia. This is a major leap forward in science, especially with the FDA approval to ending the epidemic. The great part about this is that the last 10 years that this has been in research, the research behind this actually came from CAN.
Oh, I love it.
So a lot of people don't really realize CAN has a very extensive research and development team. So we work with the pharmaceutical companies on research of how PrEP has worked for both male and female. The results of this are phenomenal. There's 0% of infection when it comes to women and nearly 0% for men.
Amazing.
So the science that's leaped so fast forward from where we were prior to PrEP to being on PrEP now to having a 2-month injectable to now a 6-month injectable.
6 months.
Yeah, it's incredible.
It's I used to work in HIV research back in the late 90s, okay, with Care Resource. I go back to where, protease inhibitors came out, okay, where, NNRTIs, I mean, they're very basic, ACT had come out already, but, we were, to see now that we have, Gilead, which is the maker of Yeztugo, this drug, lenacapavir, which is fantastic, that Gilead has, obviously, is also profitable. Let's not forget the fact that this is a very expensive drug, okay? So, which I hope that it works somehow, because, the health system in this country and the insurance business and all that is such a mess.
It's all about money.
Know how we're going to get access to this, because apritude, the drug prior, which was made by Veeb, also had issues for access in the beginning.
So money related.
Always the problem.
It's always money.
Always.
It's always money.
But this is revolutionary.
But it's
okay, this is a freaking game changer.
This almost really made me break my 14-year celibacy. Almost. Maybe I would go back to it. It's like it's every 6 months.
Yeah, because one of the main things here is compliancy. Taking a daily drug like Truvada, Descovy, that also Gilead makes. It's a great tool, but not everybody has that compliance.
No.
If you don't have that compliance, you can develop, resistance to the drug, and then it's going to work against you. This, having twice a year, this drug makes a huge change.
And you're walking out of the office already protected, kid. You don't even have to go start taking the med.
Like the bathhouse.
You can go straight. You can go straight to behind the tire at Eagle. You can go straight there.
Right to Dig Doc and Peach House.
Right?
Yeah.
But dude, this reminds me about 20-something years ago when they started what they called salvage therapies. I think it was called fusion. It was the same thing. It was when nothing was working. It was like, oh, you've gone through all the meds. Here comes this injectable, and it changed the face. So every once in a while, I don't know what it is about intravenous, but it's when you get there, you've gotten to some good news apparently, because this exact thing happened with the salvage therapy about 20 years ago.
Yeah.
Wow. Well, cheers to science.
Right.
And cheers to Kane Community Health. Thank you so much.
Sponsor of the Sunshine Cathedral
Center for the Performing Arts also as well.
You had to get that little plug in there, didn't you?
So we love
Of course, we love Kane. We all love
had to
Kane.
inject that in the conversation.
Well, I'm still celibate.
Oh my God.
I celibate and give the rest away.
Okay.
That is the big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.